Hi, I'm Lisa. I'm Acting Elder Benefit Specialist with the Great Lakes Intertribal Council. We are here today with you to talk about Medicare. This presentation is going to cover some basics of the benefit of Medicare. It would be very easy to get into the weeds very quickly to talk about Medicare. So what I'm really hoping is upfront to share with you the three takeaways I hope you get from this presentation. One is that you have a choice. You have choices not only in the benefits that you elect, but also in who you can go to for assistance in accessing the benefits, enrolling, plan choices, and all those things. There are several kind of different cohorts of experts that you can talk to. And in the tribal communities, we are doing our best to develop strong collaborative relationships between the tribal medical benefit specialists and aging units, county aging units, and ADRCs, and the Great Lakes Intertribal Council, which is the organization that I presently work for. So choice, number one. Number two is just doing a brief overview of the different parts of Medicare. So it's the alphabet soup, A, B, C, and D. We'll cover those things with enough detail that you get an idea of what you're looking at. And finally, one of the most frequently asked questions I get has to do with purchase and referred care or contract health for which tribal members are eligible. We're going to cover that possibly in a little bit more depth because that is an enormous question, like a really frequent question that people have. Why should I elect Medicare or some other insurance if I have access to my tribal health clinic and I'm covered through the tribe? So those are the three things that we're going to talk about today. Now, first, choice. Tribal members, as I mentioned, so tribal members living on or near reservations have access to purchased and referred care in most cases. There are also, if a person has been determined disabled by the Social Security Administration, or a person has reached age 65, that person can enroll in Medicare. This is true for tribal members. This is true for not enrolled, for people who aren't enrolled tribal members. As long as a person has worked and paid into that Medicare system, and in certain circumstances, a spouse, or in certain circumstances, a spouse. At each of the tribes, the tribal health clinics employ a medical benefit specialist or Medicare eligibility outreach specialist. The titles may be different, but most definitely reach out. That is one option if you want to receive information the place that you receive most of your health care. The counties and the Great Lakes Intertribal Council employ disability benefit specialists. Disability benefit specialists work with folks 60 and younger on accessing benefits related to disability. And there are several different definitions of what having a disability means. And Medicare specifically is a benefit that is linked to Social Security disability insurance. And that is what FICA taxes that are taken out of payroll checks pay into for eligibility. So disability benefit specialists work with folks 60 and younger. Now, folks 60 and older have a choice also between tribal elder benefit specialists and the counties. Most counties operate aging and disability resource centers. Some are collaborative, multiple counties, some are single county. But I find myself getting into the weeds on that. So when it comes to elder benefits, now there are some complications in light of COVID-19 that several elder benefit specialists employed by tribal aging units have been laid off or furloughed until we can fully open operations back up. Until that time, the Great Lakes Intertribal Council Elder Benefit Specialist is a resource that will either be able to provide information assistance, application assistance, referrals, in place of until the tribal aging units and the tribal elder benefit specialists are all back up and running. So those are choices. Now, I'm going to circle back to choice after we talk about the different parts of Medicare. So this is where we get into the alphabet soup, and even I need to look at notes for this. Okay, so if you're approaching age 65, you have probably begun getting copious amounts of mail from Centers for Medicaid and Medicare and Medicaid Services, CMS, and or Social Security, and or AARP. Several other sources will be mailing you information. I can't emphasize enough the importance of opening those pieces of mail. It does frequently happen that a Medicare card is sent to soon-to-be beneficiary, and it might look like junk mail, and so a lot of people throw those away. So very important to open up that mail. If it looks confusing to you, please don't hesitate to call one of the benefit specialists that I outlined earlier. Taking into consideration, what other needs you might have, and we'll get into some more of that as we go through the presentation. So Medicare Part A is your inpatient hospital services. This will automatically start if eligible, and all of these things, please keep in mind that if there has been sufficient contribution through FICA taxation to this program, Part A hospital insurance would be premium free. It is premium free for most people. This it can cover skilled nursing facility care, home health care, and inpatient mental health services, among others. So Part A, hospital insurance, for most people, it's premium free. And you don't have to decline or elect coverage. Part B, it would be coverage for your clinical services. So this would be when you go to your tribal health clinic for your annual preventative exams, any checkups, any acute care, injuries, consultations, those kinds of things. Now, for Part B, there is a premium, and currently it's running around $145. And when we start talking about purchase and referred care, we'll talk about that, how many of the tribes deal with that Medicare Part B premium. So Part A, hospital, Part B, clinic, or your typical kind of health insurance, healthcare insurance. Important to note that Medicare only covers 80% of the cost of care. The remaining 20% is typically billed to the beneficiary. And then there's Part D. And Part D is a little bit easier to remember what it is for because it's the prescription drug plan for Medicare, for original Medicare. Another of my colleagues will be talking about senior care, which is another prescription drug coverage option for elders. So I'll leave that go for now. But Part D is prescription drug coverage. There is Part C. Part C is separate from original Medicare. Original Medicare, A, B, and D. Part C, also known as Medicare Advantage plans. Some people call them Medicare Advantage plans. These are kind of standalone plans that are run by private insurance organizations or private insurance companies. And there are rules that they have to abide by in order to provide basically a Medicare replacement. So right now, to kind of summarize, I've outlined two different options that people have. Original Medicare, A, B, D, and the second option would be Part C, which is a Medicare replacement. It must cover all the same things. Many Advantage plans have higher premiums, but they also have more benefits. So it's a good idea, if you want to fully understand your options, to have a chat with a benefit specialist. And then there are also, now this is, what I'm about to talk about is separate from these two other options, Original Medicare and Advantage plans. And it's called Medigap or Medicare Supplement. As I mentioned, Medicare only covers 80% of the cost of care. So an individual can take a look at Medigap, also known as Medicare Supplement policies, that, as the term Medigap might imply, fills in some of the gaps of Medicare, so that, say a person doesn't want to be on the hook for that 20%, or for the premium, for a particular premium. So a Medigap policy or Medicare Supplement will potentially, like, now this is more in like a competitive marketplace. So in a marketplace, there, like any competitive business, like, there are going to be variable costs and benefits. So again, a good idea to talk with a benefit specialist to help you understand what those options are. Those options available depend on a person's zip code. Some companies only operate in certain areas. So, and typically, like, Medicare Advantage plans have extra benefits usually anyway. So the Medicare Supplement or Medigap is usually paired with Original Medicare. Are you still with me? That's a lot. And I feel that I hear the words come out of my mouth and it sounds confusing. So those are basically the A, B, C, D of Medicare. Now, finally, one of the most important things for tribal members is to decide, like, why Medicare at all? In many cases, particularly for elders, and often for people with disabilities, the tribe covers medications at 100%, and there is frequently no cost of care at all for the member, the patient, him or herself. So why do it? And that's a complex question, but one that is really important to discuss the implications of. Tribal health clinics are largely funded by IHS or Indian Health Services dollars. Those dollars are limited. They're specific, finite, and they often, it's not enough typically to cover all enrolled members living in that tribal health clinic service area. And many of you are aware, I'm sure, that tribal health clinics, sometimes mid-year, sometimes before June, might go to a priority type basis where they will only cover full costs of care. They're only able to cover full cost of care for people most in need. So the people who are the sickest. And so that reduces availability and accessibility of care really for the entire community. So many tribes will incentivize enrollment in other health coverages like Medicare or Medicaid or private insurance, Affordable Care Act. I mentioned earlier that a lot of Medicaid eligibility outreach specialists at the clinics are well-versed in the Affordable Care Act plans and enrollment and helping people select a plan that works for them. And what I mean by incentivize is some tribes, not all, please keep that in mind. Again, why it's important to become frequent flyers to your benefit specialist folks in your communities who know precisely what's going on at the clinics and with tribal funding of health services. But some tribes will pay for premiums or reimburse if a person is not eligible for other cost assistant programs. So the other aspect of whether or not to enroll in, say, a Medicare program, a Medicare plan, because there are premiums associated and coinsurance associated at 20%. 20% of a gazillion dollars is still unaffordable to most people. There are many situations, and supplement now, not to be confused with Medicare supplement programs or Medigap, but there are Medicare savings programs that are available through the state of Wisconsin and are operated under Medicaid funding. And we don't need to hopefully get into the weeds of Medicare versus Medicaid. Medicare, when you think of Medicare, think 65. When you think of Medicaid, think aid or assistance for people who might have lower income or higher healthcare needs, like increased healthcare needs related to like supplemental security income, which I'll talk about in another presentation. So contract health, why take Medicare, or purchase and referred care, why take Medicare? Because not enrolling in programs for which people are eligible, other insurances and health coverage for which people are eligible, hurts the tribal health clinic's bottom line, and also thereby their ability to serve the entire community. Second reason to consider when figuring out whether or not you want to enroll in Medicare. If you're eligible, you paid into the system. You and or spouse paid into the system. You are eligible for that coverage. I don't want to say that not using Medicare would then have wasted those dollars from your paychecks all those years, but one could frame it that way. You paid in, and this is where the term entitlement gets very fuzzy, but it is a benefit for which people who paid into the system are entitled. It is not a welfare program. It's not a public assistance program. Medicare is, people are entitled to it through their work activity and paying into the system. So that's another reason that people might lean toward enrolling in Medicare. The premium, and this is where I'm going to get maybe a little bit more into the weeds about the premiums. Some people don't want to enroll in Medicare because of the cost of it. Why would I enroll in something that I need to pay for when I can just keep getting my care at the clinic and using purchase and referred care, and then I don't have to pay a dime. Many people are eligible for Medicare savings programs. I mentioned earlier that are Medicaid administered programs that will either, depending on a person's level of income and assets or countable resources, for some people, the premium is covered. For some people who are not eligible for a Medicare savings program, the tribe in which they're enrolled will reimburse them for the cost of that care. Because again, ultimately, then the clinic can bill Medicare instead of billing contract health. So that frees up those funds to be able to serve more people and or add services to the community clinic rather than having to refer out and sending people far away to get care. And that has enormous community value to individuals, families, and the community as a whole. And then finally, that 20% related to the Medicare savings programs that can cover the premium. Those Medicare savings programs for some people with the lowest income. And for a ballpark, so you have some of those figures. And I should have highlighted this so I could see it quickly. But for household size of one, so if an elder, if you are living on your own, $1,066.33 and lower, the entire Medicare. And now there are some other qualifications, so I'm not guaranteeing eligibility for this benefit. But if a person's income is below $1,066.33, accountable income also, is below that, then they would be a qualified Medicare beneficiary, and it's basically dually eligible for both Medicare and full benefit Medicaid. And the clinic would be able to bill these other insurance providers, these other coverage providers, again, freeing up those funds for the tribal health clinic, and people who aren't eligible for anything else or don't have access to any other type of coverage. For some of the other programs, $1,276, $1,276, $1,435. So there are assistance programs available to help people with the costs of Part B premium and coinsurance. That's that 20%, and also Part D, the prescription drug plans. So to sum up, now Medicare, if you're still with me, is clearly complicated. We've made a very complex system of care, and not even care, but of paying for care. So as a recap, I'm going to start with purchase referred care and why take it. There are consequences for individuals, families, and communities when people are eligible for benefits and they elect not to take them. That cost ends up staying with the tribe, and maybe that's an incentive for somebody not to enroll. Which then leads me to the choice piece, that no matter what, I may have come off as persuasively being persuasive about enrollment in Medicare. I forgot to mention paperwork, that there are annual enrollment periods and special enrollment periods. And if you move and if you like to travel, which incidentally is another reason that Medicare is enrolling in Medicare would have consequences, or I should say not enrolling in Medicare would have consequences if a person travels frequently and is not necessarily staying on or near reservation or within an IHS service area in an urban healthcare center. Urban Indian Healthcare Center. So there may be implications for coverage if a person's only choice or only coverage is purchase and referred care through their tribe when they're traveling. That varies a lot. So in that way, Medicare can be perceived as more predictable and stable. It's reliable, like a person can travel with it, if that's what they're doing is traveling. Like if you're moving someplace else, then there are coverage changes that would have to take place. But I'm getting into the weeds now. So the bottom line then really is know your benefit specialists, whether it's the medical benefit specialist, the disability benefit specialist, and or your elder benefit specialist within the tribe or with the county. We are trained, we have legal supervision, we receive legal supervision to consult on more complex issues. So we will be posting links for you to find contact information for any benefit specialist that will be able to help you sort through your specific options. Again, Part A, B, and D are relatively standard, but if you want to look at Medigap policies, if you just want reassurance that you're doing the right thing, filling out a piece of paperwork correctly, or if it's even something that you need to respond to, a benefit specialist can help you with that. So I do hope I haven't lost you on all of that. And I do encourage you to make use of the links, phone numbers, emails of benefit specialists available to you to help weed through the marshes of Medicare. Thank you for being with us today. Take care.